So, acceptance is one of the core processes involved in psychological flexibility. It's one of those sides of the six sided Rubik's Cube that I talked about in our first episode. And in ACT, acceptance is different than maybe what a lot of sort of in our vernacular we think of in terms of acceptance. When I'm talking about acceptance, I don't necessarily mean acceptance of the outer world, like accepting your brother in law. What I'm talking about is acceptance of what is showing up under your skin when those difficult things show up in your life. Kirk Strassel, who's one of the co founders of ACT, talks about acceptance in terms of these five things. Teams, the acronym is TEAMS. So T, acceptance of our thoughts. E, acceptance of our emotions. A, acceptance of our action urges, those sort of cravings that can show up. M, acceptance of our memories. And S, acceptance of our sensations. In ACT, we're talking about making room for and space for whatever shows up inside of ourselves in the present moment. When I asked my mom, who's been married almost 50 years to my dad, what is the secret to her marriage? She said two things. She said, first, that when she gets into a fight with my dad, they have an agreement that the first person to drop it is the winner. And then if you pick it up again and say, I won because I dropped it first, then you're no longer the winner. You have to be willing to drop it in order to win. The second thing she said is acceptance that you cannot change another person. When you find dental floss on the couch, you let it go. Whether you are stuck in an unhealthy behavior or you hold back from playing big in your life or maybe setting boundaries, what acceptance does is it gives you the flexibility to be able to get into that wetness, that discomfort, so that you can move more freely towards being the type of person that you want to be in the world. In the book Radical Acceptance, Tara Brach describes acceptance as having sort of these two parts, like wings of a bird, where one wing is being able to see clearly, and the other is to hold our experience with compassion. We take a look at what we're grasping or what we're running away from, and we gently let go, and we open up with care and with kindness. I was recently in a workshop with Jack Cornfield, and he talked about acceptance in meditation. And he said that in meditation, it's inevitable that there's going to be sort of a restlessness that shows up. And when that restlessness shows up, what we can do is we can just start by naming it restlessness. It'll continue to show up, and you just name it gently, whisper restlessness, and come back to your breath. But sometimes the restlessness is so loud and screaming and feels impossible that just naming it is not enough. And when that happens, what he recommended was you say, okay, take me now, kill me, take me, restlessness, take me. And you completely surrender to the restlessness. You say, I will be the first person to die of restlessness in my meditation. And in doing that, in that complete surrender and that complete letting go, you will find that you just become free of the restlessness. This maps on to those sort of micro discomforts in life, like restlessness during meditation, but it also maps on to the bigger things in life, like facing loss and grief or rejection. That when we can be with ourselves in those moments and surrender to the experience, open up and allow for it, we can find freedom up. There's a classic study by Stephen Hayes where he had folks put their hands in cold water, and they were assigned to one of three groups. They were either assigned to a control group, sort of do nothing, or they were assigned to a cognitive restructuring group. Think about it differently. Try and distract yourself from the fact that your hand is getting colder. Do whatever you can to distract from the cold water. And then the third group was an acceptance-based group in which they were told to open up and allow for the experience of coldness. And what they found in response to this physical task, the aversive physical task, is that the folks that were in the acceptance group, not only did they report lower subjective experience of discomfort, it wasn't as painful when you practice acceptance compared to the control group, but they also were able to keep their hand in the water a little bit longer. Our hands, in many ways, during this pandemic have been in the water way too long. And if you're a person that's experienced trauma in your life or experienced a lot of adversity or experienced depression, it can feel like these waters are impossible to stay in. I want to say that acceptance doesn't mean that you don't take your hand out of the water at some point. Acceptance is actually doing what Tara Brach says of being able to see clearly and also have compassion for your experience so that you can make that wise decision of what to do next. Neuroscience research also shows us that when we are practicing acceptance, and in this particular, this mindful type of acceptance, it actually can attenuate the areas of our brain that are activated in experiences associated with pain, whether that's physical pain due to a temperature test or emotional pain, like watching a video of someone in pain. When we practice mindful acceptance, it changes our brain, and in particular, those areas that are receptive to pain. Another interesting thing is that when we practice acceptance, it's more of a bottom up practice as opposed to a top down one, which means instead of trying to think our way into feeling differently, we feel our way into having a relationship that's different with our discomfort. And neuroscience research has shown that actually, when people practice mindful awareness in response to an aversive stimuli, whether it's physical or emotional, we don't see as much activation in the prefrontal cortex as we do with something like cognitive restructuring. Third wave psychology, things like mindfulness based stress reduction, dialectical behavior therapy, ACT, are using a lot of these acceptance based principles to help you be able to navigate the discomfort of living differently. But this is something that you already know for yourself. This is something that preschool teachers know. When a parent leaves a child at school and the child starts to cry, the preschool teacher doesn't give the child straight back to the mother, but rather works with being present with the child long enough so that they can develop the skill set of acceptance of this new environment. So let's take a moment to look at what is and what is not acceptance. One of the biggest mistakes that I make as a therapist and as a parent and as a friend and a daughter is pushing another person to accept when we're not on the same page about what it really means. When I'm talking about acceptance, I don't mean approval, being passive, allowing for harm, abuse, or oppression, resigning, or self indulgence. But rather, when you look at the Latin word for accept, it comes from the root to receive what is offered. So if the word acceptance makes you cringe, here are some alternative words that you could try on: being willing, allowing, making space for, breathing into, letting go, being brave, letting it be, opening to life as it is, curiosity. I think that those words encapsulate a little bit better what we're talking about when we're talking about acceptance. So I mentioned that we need to practice micro acceptance before we can move on to macro acceptance. And one of the places where I've learned to practice micro acceptance is in my work. I have a tendency to get anxious before new clients. And this has been the case for 15 years, right? A new client contacts me. I'm anxious. I call them back. I'm anxious on the phone call. They come to my office and I'm still anxious. What I've learned to do with that anxiety is to expect it, to know that it's there because it's linked to something that I care about, and also kind of and also know the places in what and also know what I tend to do to try to manage the anxiety that actually prevents me from being the type of therapist that I want to be. The ways in which I stand on the sidelines of the pool rather than getting wet with my clients, right? So recently I had a client come to my office. I've been seeing some folks outside on the porch at a distance. And this client comes to my office and I'm having my normal bout of anxiety before seeing a new client. And my office can be hard to find at first. And so I walk out to go and meet her and I can feel the anxiety and I bring it with me and bring it with me to meet her. And we walk back to my office and I lead the way. And as we get to my office, my client says, this is my new client that I've never met before, says, I think that you should fix your skirt. And I look around and my skirt is completely tucked into my underpants, like complete bare bottom exposed. And I have that moment of take me now, as Jack Cornfield would say, take me now. And in some ways, that's it. Right? We all have our skirts tucked into our underpants to some degree or another, but we try and pretend like we don't. We go around the world covering up the things that make us vulnerable and the things that make us human. Take me now. And it's in that radical acceptance, actually, of just like surrendering that allows us to be able to move more freely in our lives. Rick Hansen, who's been a mentor of mine for the past few years, gave me the recommendation when starting this podcast to practice renunciation. The term renunciation sounds sort of not so great. Who would want to renunciate? But what he helped me understand is that in Buddhism, renunciation, the term renunciation, is really about realizing your basic goodness. Renunciation is realizing that you already have exactly what you need, and what you have is already good.